from the gray hair I have, I believe I will be probably one of the most senior people in this room. And I hope to share with you my experience in the past 30 years in regenerative medicine. And this is my background. And my background, which is a bit different. And I'm probably the only plastic surgeon in this room. So I'm a surgeon by training, and I'm trained in the University of Chicago. And the other thing, which is a bit different from the audience, is that I'm also a PhD in physical chemistry. So with that as my background, so the way I'm looking at the functional medicine and the integrated medicine or anti-aging probably is a little bit different from the viewpoint of the previous speakers. And this is my disclosure, and I've been invited to go back to Taiwan 20 years ago, and I've been doing some administrative work for the hospitals, and eventually I have started about 4 different companies. And today I'm here and to also representing our partner in Indonesia, in Jakarta, the Biogenesis Laboratory. And my company working with Biogenesis Laboratory is Lotus Biochemicals. And my staff just remind me that the abbreviation of this is LB and BL, okay? That's a good sign for the abbreviation. So the purpose of this company is aiming to be the largest personalized biologics in the Southeast Asia. So with that as my background, let me try to keep you awake at the end of this day. And I'm sure you guys are all doing very well, and I will try my best to keep this going. So histologically, you can see it doesn't matter what type of tissue. The tissue of the muscle, of the skin, or the liver all share the very similar structure. You can see blood vessels passing through tissues and with a lot of red blood cells inside, right? So if you want to build up a generalized model of human body, you can see this will be, you're going to have something like this. You will have the intravascular space, the interstitial space, and the intracellular space. So the first generalized principle in biology or in medicine is all of the cells in our body is either living in the plasma or living in the derivatives of the plasma. So as a result of that, the way we can simplify the human body or the human health using this type of cartoon picture. So the total of the 37 trillion of cells, all of them is tightly related to the 3,000 cc of the plasma, which is approximately the size of the water in front of you. And with that being said, the quality of the plasma is, of course, crucial to the wellness and to the longevity. I have been doing stem cells since 1994. So with this, that's about 29 years. So 29 years ago, that was 1994, in Children's Hospital of Philadelphia. We are the first surgeon who used the bone marrow stem cells of the children to repair the cranial bone. And until now, we are finally seeing the stem cell therapy become more popularized and commercialized. With 30 years of experience in stem cell application, I can tell you that if you do it properly, the stem cell injection to the face or to the hair doesn't work. So the stem cell local injection is effective. This is a general consensus. However, we are talking about systemic anti-aging. obviously there is no one on the earth, I think, would want to do injections of the stem cell to the brain, to the heart, and to the liver one by one in order to gain the longevity. So this route is not possible, although it does work. So that's the reason we see the stem cell infusion, intravenous infusions, become very popular in the clinical world or in the commercial settings. The problem of the stem cell infusion is all the vasculature in our human body is like a one-way street. So all the cells injected into the vein eventually go to the right heart and go to the lung. And the diameter of the pulmonary capillary is so small, it's only 8 micrometer. So anything larger than 8 micrometer cannot pass. So as a result of that, the mesenchymal stem cells, which are the most common stem cell being infused, which is commonly has a diameter of around 50 to 80 micrometer, will get stuck in the lung. So because of that effect, the stem cell infusion can only work directly in the lung. And a very small portion of the stem cell might go to the liver through the portal circulation. But the rest of the body, the stem cell cannot go there. So that's the reason we are going to do more work. Despite of the stem cells researches, we need to find new scientific ways to accomplish systemic rejuvenation. So fortunately, about more than 100 years ago, there was an experimental technology being developed by several pioneers. And the experiment is very simple. Basically, you just use the surgery to connect an old animal, an old mice, with a young mice. And the first guy who did this was back in 1864, Paul Burt, and followed by Dr. Alex Carroll, who is also from the University of Chicago, which is my alma mater. And the third person is the Dr. McVeigh in Cornell, 1957. And he is also the guy who began the research on the calorie restriction. So in short, we are all standing on the shoulder of the giants to accomplish what we are talking about today. After you connect the two mice, the old mice with the young mice, and something magical happens. About 5 weeks later, it takes about 3 days to establish the common circulation. And another 2 weeks later, the old mice or the old rat become younger. And to date, this method, heterochronic parabiosis, is still the only rapid and visible aging reversal experimental method. All the other methods, either a cellular experiment or animal experiment, which you don't see them become younger, or you can do a test, okay? And this one is very fast, only takes about 2 weeks, and you can see the rat become younger. The question is, how can we apply this type of experimental technology in a human? So you can begin to think, how can you connect two humans together? And the first things coming to our mind should be the Siamese twins. But the twins, usually they are the same age. So this is an example of isochronic parabiosis. The other example is pregnancy. The mother connected to the infant, or the fetus. The fetus is always younger than the mother. So this is a good example of the heterochronic parabiosis, except that the size of the infant is only about 1/20 of the mother. So we can name this, consider this as the pregnancy as the model of asymmetric heterochronic parabiosis. Based on a very comprehensive anthropological studies done in the semi group of women, and you can see that the chance of the mother who has the last pregnancy at the age of 45, as compared to the mother who has the last pregnancy at the age of 35, the chance of the 45 years old mother to live to 80 years old is increased by 50%, 50%. So this is the hard evidence that heterochronic parabiosis also works the issue. But with that being said, the challenge remains. This is how to simulate the heterochronic parabiosis in a clinical setting. Of course, for women in the childbearing age, they can go home and get pregnant, and they can perform a natural heterochronic parabiosis. And for men or women who is more after their menopause, and this option does not exist anymore. And people has been trying to use this type of technique to simulate the effect of heterochronic parabiosis. And the most famous one is this company called Ambrosia, and this company basically used money to buy the blood from the college student and reinfuse them back to their customer. And the newest advancement is this gentleman, Brian Johnson. He's a CEO of a high-tech company. So he began to use the living-related plasma transfusion in order to gain anti-aging effect. Although he claims that he doesn't feel much of an effect on doing this. And at the later of this talk, I hope to explain to you why Brian Johnson infused the blood from his son doesn't work. The second type of approach is Dr. Dobrikipro from the San Francisco area, and he's the #1 specialist of the apheresis stage. So the approach what he is using the plasma exchange machine to remove the old substance and replace it with fresh frozen plasma or the albumin type of replacement fluid. My journey of doing the clinical simulation of the heterochronic parabiosis started in 2016. And by coincidence, by chance, I was invited to Phnom Penh, Cambodia, to treat some of the patients over there. When I get to Cambodia, I realized that because of the Khmer rules, so the average population age in Cambodia is very, very young. And at that time, you can easily get some blood from the teenagers on the street. So with that background, and I have this simple thought, probably like everybody else, I just think, hey, this is going to be a good business, right? We can collect few $10 to get the blood from the people on the street and sell it for more money, okay? So with that being said, we rented the residence of Angelina Jolie back in 2017, and we want to start an anti-aging clinic in Phnom Penh. At that time, a couple scientists in Berkeley published a landmark paper on heterochronic parabiosis. And what they show is that the old blood actually has a very strong inhibitory effect on the organ of the young rat, of the young animal. So because old blood is toxic, so we simply come up with an idea. Just use the therapeutic plasmapheresis machine combined with the fresh frozen plasma of the teenager. So we begin to do this type of therapy. The problem of using a TPE machine is because it's a risk of thromboembolic effect. And you need to be immobilized for about 3 to 4 hours. So the patient doesn't really like the idea, especially the psychological effect of watching your blood circulating outside, and some of my clients cannot really accept this type of aggressive procedures. So with that feedback from my clients, so we begin to use my chemistry background to think that how can we, using very simple methods and the legal method, to simulate the effect of the heterochronic parabiosis in the human body. So we come up with this idea of using something called cellular titration. So what it says is just we use bloodletting and combined with young plasma replacement. And the young plasma is a compounding solution, and with this approach, and it has several advantages over the plasmapheresis method. So we go ahead with the animal study and prove that this type of cellular titration can make the plasma become thinner and younger. And I know everybody in the room, as a doctor, you know, the bloodletting, of course, is not a problem. For men, you can easily take out 200 to 500 cc, and the 100 to 250 cc for women, and just based on the guideline of the blood bank. So the challenge remains is how can we create the young plasma analog? And just like the speaker in this morning, because I'm trained in the States, so we are very familiar with the compounding service. So at that time, we easily come up with something very simple formulation, which is using the albumin and the IVIG, plus oxytocin and several hormones to compound it, and with some of the vitamins and the amino acids. So we created a compounding solution and begin to do the treatment. Of course, this is not enough because the blood in the plasma, there are about 10,000 or even more proteins inside. So it's very difficult to come up with a generalized solution. So in 2019, Professor Tony Wiscorel of Stanford University, and he did a very monumentary work on the plasma proteome across the age. What he does is measure about 4,000 different proteins across the age between 18 years old to 19 years old. And he measured the concentration of 2,925 proteins. So, and after doing that, he traced all these 2,925 proteins against the age. And he are able to classify all the plasma proteins into 80 different types. So basically what those categories are, the type 1 is the same between young and old. And the type 2, 3, 4, 6, 7, all these 5 group of proteins increase with age. And the cluster 8 and cluster 5 and 8 decrease with age. So in other words, he's able to sort it out using the advanced proteomic methods about all the compositions of the young protein and the old protein. So for the young proteins, which is the only one matters to us, is cluster 5, which has about 204 of them, and it's mostly related to the extracellular matrix, the growth factors, exosome, and the transport proteins. And for cluster 8 proteins, there are 8 of them. Most of them are growth factor receptors and the receptor tyrosine kinase. So our interest become using the bloodletting to reduce the good protein and the bad protein simultaneously. And after that, we will replace them with the cluster formulas, which is rich in cluster 5 and 8. And so the challenge now become identify where on the Earth can you find the cluster 5 and 8 proteins. And fortunately, we can find it a lot of them in the PRP, which everybody is familiar. And we also are able to identify those cluster proteins from the secretomes of the stem cells. So after some physical calculations of the kinetics, then we are able to determine the program to be biweekly replacement of 150 cc of the plasma or weekly replacement of 100 cc of plasma. So this approach, which is the second generation of the plasma conditioning, or second generation of the clinical simulation of the heterochronic parabiosis, we started doing this in the third quarter of 2018 until the second quarter of 2024, which is last year. And these are some of the clinical results. And these are stroke victims and come to the clinic on the wheelchair, cannot stand up. And after about 20 sessions of this treatment, he's able to play the tennis again. And we treat about several dozens of patients with chronic kidney disease. And the eGFR after the plasma treatment, they on average will improve by about 1.5%, and nobody will go into dialysis during the treatment. And this is a slide shows the almost immediate results of the sense of space of Alzheimer patients immediately after the plasma treatment, and 3 months later, and he's able to maintain the sense of space. And we also treat patients of late stage cancer. You can see the cancer markers and the inflammatory indexes. Most of them decreased by about 70%, 70%. And these are the extreme aging patients. And this gentleman is 95 years old, and this lady is 94 years old. And you can see after the plasma conditioning session, and she can regrow her hair in black color. And we have many more cases, and these are being done in Malaysia, in Taiwan, and now a lot of cases in Indonesia and China. But this approach is not perfect because everybody ages differently. So this type of one-size-fits-all approach doesn't work. So after the COVID-19, I had to expand our practice into China, Malaysia, and Indonesia. And with these 3 countries, the common thing is they have a lot of type 2 diabetics patients. So every day I almost need to explain the effect of the sugar on the secretion of the insulin. In this slide, you can see, if you give the beta cell a lot of high glucose, it will secrete a lot of insulin. If you give it the normal glucose, it will secrete a little in some insulin. But if you give the beta cell a low glucose solution, the beta cell obviously is not going to secrete insulin. Otherwise, the patient is get into hypoglycemia. So this is nature's homeostasis. So inspired by these type 2 diabetic patients, so we think, just like using the glucose content, you can guide the beta cell to secrete the insulin. We can use the plasma of the aging patient to secrete the growth factors and to let them regain their useful proteins. So this is like if you give the stem cell the healthy plasma, it will secrete a little bit of the proteins of the growth factor or repair proteomes. But if you give the stem cell injured plasma, it will secrete lots of this substance. And if you give them the aging plasma, it will secrete adequate amount of the plasma. So this approach basically will use the patient's own plasma to guide the stem cell in the laboratory to secrete what is lack of or what is short of in the plasma. And the approach is very attractive because this is a 100% autologous approach. But we need to have technology to remove the toxins in the old plasma, and we also need a healthy and young stem cell to respond to the own plasma. So this side, the blue side is a stem cells, growth of stem cells stimulated by the plasma of 85 years old. And you can see the response is about 300% higher than that by stimulating it using a 25 years old plasma. So in essence, the approach or the program now, we can just draw 100 cc of the patient's plasma. And after processing in a GMP facility, and we use that to stimulate the stem cell in the laboratory to produce what the patient needs to regain their health and the wellness. So, because we only need 100 cc of the patient's blood and to titrate it, to expand it, and reinfuse it back into the patient's body to reset their internal environment. So we call it PS100, plasma exchange with 100 cc of the plasma. And these are the data from using this type of approach. We call it APA, means autologous plasma adapted, okay? So this is the first APA patient, which is a patient from China. And he came to us with the HbA1c of 16.5. And he did 3 sessions of this type of therapy, and the HbA1c dropped to 6.3, okay? And people were asked, how long does it last? And about 1 month ago, I saw him in Shenzhen, China, our clinic in Shenzhen, China, and his current HbA1c is 7.5. And this is another example in Jakarta. And the patient who had a stroke of the retina, and before the treatment, he needs to get an injection every 30 days. And after 6 sessions of the PX100, the interval of the injection increased to 130 days. So it's 400% decrease in terms of the severity of the eye stroke. And in our partner, and guided by Ms. David Guo in Jakarta, Anho Clinic, and we have conducted some real-world clinical data trials. And we actually follow all those patients and to measure the before and after HbA1c, eGFR, LDL, triglyceride, and the hsCRP. And the response rate is more than 70%. And for patients who is busy or from another country, and you can do the PX100 consecutively in 3 days. So you can see this patient after 3 days, the plasma activity increased from 0.41 to more than double to 0.96, and the toxicity also decreased. So up to now, we have done this since 2018. We have performed this type of plasma condition decisions for more than 5,000 cases in 6 different countries. So the clinical effect, usually the patient feel they have more power, they feel more energetic, and immunity increase. We don't have patients acquire cancer during this procedure, and we don't have any patients who had a recurrent heart attack or recurrent stroke during this period of time. The kidney function, all of them increase, and the cognitive function and the cardiovascular and the cancer recurrence and the cardiovascular risk also decrease. So the indication for this type of therapy is cerebrovascular accident, type 2 diabetes, chronic kidney disease, dementia, Alzheimer, late-stage cancer, nutritional support for late-stage cancer patients, and the treatment for frailty and sarcopenia. So we do have training workshops in different countries, and continue to train and educate physicians interested in doing anti-aging or regenerative medicine. The future of the PX100 is just like the development of the medicine. So people has gone from go to a GP, general practitioner, to a specialist. And I personally think be going into the subspecialty list type of therapy. So this type of cell is called organ-specific progenitor cells. And I'm sure most of you are familiar with this. So for people who doesn't know about the progenitor cell, in one short sentence, progenitor cells are still stem cells. They are the last step of the stem cells. And after so their function is more specific. And the problem is the progenitor cells, the HLA expression is more complete. So you cannot do the allogeneic progenitor cell transplant. So this is our partners in Taiwan. He has been doing the autologous endothelial progenitor cell therapy for the heart, for ischemic heart disease. And you can see the before and after. You can see a lot of growth of the blood vessels using the intracoronary easy infusion. And obviously, you cannot do the intracoronary infusion or intraarterial infusion on every patient. So we are beginning to develop techniques of using the secretons of the progenitor cells and to treat our patients. And this is a very, very important paper in the field of the regenerative medicine. Yeah, this is published last year in Lancet. So basically, this paper says that you can use the secreton of the cardiac progenitor cells and they convert a New York heart failure classification stage 3 patient into stage 2. Okay? And we are also doing this. So in the future, you are going to have PX100 for the heart and the PX100 for the brain. And this is also fit into the prediction of the economic prediction of the cell therapy in the future. So what we are doing now is we have a GMP compliant laboratory. So we were providing clinic and hospital facing type of services to produce GMP grade personalized biologics. And we also, in order to limit the human errors, so we are developing automatic machines. So the GMP laboratory in Jakarta will be eventually will be operated by robotics, semi-automation. And the purpose of doing all this is trying to do the heterochronic transbiosis. And this is the world map, world picture of the organ shortage. And scientists in Colombia are already using this type of technique to repair the damaged lung. And we also use this technique to repair the damaged kidney. And you can see the damaged kidney with some of the plasma PX100 like of treatment. You can resume their function. So this is called the ex vivo organ regeneration. And we hope to work with a school in the Tomohon in Sulawesi. So hopefully next year we have a chance to present it to you about our new research developments. And eventually we hope to come up with a device which can replace the need of the young animal. So we'll come to the last 1 minute of the talk. So you guys should give yourself an applause because I just presented to you the work of 6 Nobel Prize. The one on the left side, the 3 on the left are surgeons. The other 3 on the right side are chemists. And this is, I want to close my talk with what my professor said in Chicago. He said, when I was attempting it, people say it is impossible. When I found it, people were skeptical. When everything is established and the dust was settled, people say that was obvious. So I have a book about this. I tell you the stories about what I just told you. And if you are interested, and again, I want to thank you for listening to me.